Hello, it is a pleasure to be here with you today. My name is Rachele Peterson. I want to thank Quincy Birdsong and SOCRA for inviting me to present during this plenary session and for their ultimate flexibility in taking this conference virtual. I am excited to present From Data to Discoveries, creating a research program for all of us. My work on the All of Us research program is funded by the National Institutes of Health at Vibrent under a cooperative agreement and other transaction awards as shown here, and I have no conflicts of interest to declare. The goal of today's presentation is to understand the mission, objectives, and scientific framework of the All of Us research program, to discuss the unique resource being developed, and to be able to identify clinical research questions where the All of Us research program could serve as a data source. I want to step back for just a moment and take a look at the big picture over the last 3 decades. The Human Genome Project at the National Institutes of Health has been compared to the NASA moon landing as an outstanding scientific achievement of humankind. Dr. Francis Collins, shown here, who is now the director of NIH, led the Human Genome Project effort as its principal investigator to map and sequence the 3 billion letters of the human DNA instruction book. This first sequencing of the human genome cost anywhere from $500 million to $1 billion and took about 15 years. As a society, we tend to overestimate the impact that such scientific advances have in the short term and underestimate their long-term impact. But if we fast forward to today, another 15 years later, the cost of sequencing a human genome is now less than $1,000. What can we do with this data? And what really comes next, logically, after the Human Genome Project is the All of Us research program. With genetic information as one essential puzzle piece, much can be done. Consider again Dr. Collins's work. On the left side here, you see the diary entry of Jenny at age 8, on the day his lab discovered the first genetic mutation for cystic fibrosis. With this, an avalanche of clinical research and resulting treatments began to unfold. And 30 years later, the FDA has approved treatment options for 90% of patients with cystic fibrosis. Jenny today is 38 years old and a mother. This is the power of clinical research and precision medicine. Precision medicine is essentially the right treatment for the right person at the right time. In some ways, it can be thought of in a rudimentary but nevertheless vitally important health product like eyeglasses. This prescription works for me and just me. I have very poor eyesight. Even my own left lens wouldn't work in my right eye. Precision medicine takes into account this individual variability in biology, as well as lifestyle, socioeconomics, and environment. We have this capability to provide targeted treatment for certain diseases based on a unique patient's profile, such as in the case of some cancers, hepatitis, the aforementioned cystic fibrosis. What if we combined biology with the patient's lifestyle, surrounding environment, and other data voluntarily shared from many sources? This is all now feasible. We have technologies that can collect and crunch huge amounts of data. More people are engaged in their health and can track it on devices such as smartphones or wearable devices. And we have this greater understanding of human genes and analysis that can be done cost effectively. So the time is right from a technology perspective. Importantly, it is also right from the perspective of patients, healthcare providers, and the research community. Today's treatments are designed for the average patient, and they may not serve you or me well. I may be one of those 2% of people who have an adverse reaction to a specific medication that right now would only be a guessing game for my doctor. We know many people, communities, and populations are left out of biomedical research as well, and patients may not have access to their own health data in the health system or access to their data as part of the research studies that they join. In the biomedical and clinical research communities, the bar can be so inordinately high to create new IT systems, databases, and analytic tools to collect this data at scale with enormous costs and time just to recruit research participants. So the All of Us research program is looking with that long-range view to propose a long-term relationship where the value for participants and for researchers and healthcare providers grows over time. The mission of the All of Us research program is to accelerate health research and medical breakthroughs, enabling this individualized prevention, treatment, and care for all of us. We aim to do this by creating and nurturing relationships with 1 million or more participants who are partners in the program with us from all walks of life for decades. Our hope is to deliver the largest, richest biomedical resource with many different data types from a diverse group of participants, making it easy, safe, and free to use, thereby catalyzing a robust ecosystem of researchers and funders to use the data for tens of thousands of studies to come. Acceleration is a key aspect of the program's mission. Our hope is that by creating this rich research resource and making it available to all researchers, we will be able to overcome some of the challenges that individual research studies may encounter today, helping to speed up discoveries. In the All of Us cohort of 1 million or more people, we have an emphasis on including communities that historically have been underrepresented in biomedical research. This includes certain race and ethnicities, older adults, and in the future, children, sexual and gender minorities, people with disabilities, residents of rural or non-metropolitan areas, and socioeconomic status. Again, to ensure that we're building a research effort that includes all of us and can yield advances that benefit all of us. We're building this community with a focus on participants as partners. We live and breathe the commitment to community-based participatory research, which means that all of us includes participant representatives in our governance structure at all levels, including the NIH and partner awards across the country, including community organizations. We regularly gather participant input through many channels, and the program is committed to returning information to participants. Of course, understanding health, including aging and wellness, means including time as a factor, hence the longitudinal design. So in addition to collecting electronic health record data over time, we follow up with participants through new surveys, opportunities to share wearable device data, or potentially even opportunities to provide new biospecimens. Additionally, we will share opportunities to participate in ancillary, essentially add-on studies that are proposed and approved by external researchers, such as yourself. It will provide a rich data set of electronic health records, surveys, baseline physical measures, and biospecimens, which does include genomics. And this will all be provided via a national open resource to all researchers, including open source software and tools. The data and tools will be available to researchers from traditional academic researchers to interested citizen scientists to allow more brain power per problem. The analytic tools that are now available will continue to become richer and easier to use over time. We also partner with industry leaders and apply the latest technology measures to ensure security and privacy of the participants' data. So again, really, the idea is to accelerate and catalyze innovation in the biomedical and clinical research enterprise. We think of diversity in really 4 dimensions. From the people perspective, we've talked about our commitment to include those historically underrepresented in biomedical research. We are likewise committed to bringing in people of all health statuses. This is not a disease-specific cohort. Anyone, healthy or otherwise, can join. Geographically, we want to achieve a cohort that can cover all of the United States and bring everyone who would like to volunteer into the fold. So this includes a national network of partners. We also ensure diversity of data types: surveys, physical measures, blood and urine biospecimens, saliva when necessary, and electronic health records that give us that whole picture. Participants can find out about the All of Us research program and enroll in the program through one of two pathways. The first is through healthcare provider organizations partnering across the country. This is, of course, the more traditional pathway that participants get involved in clinical research. All of Us is partnering with hundreds of institutions, including the traditional academic health centers, community hospitals, as well as federally qualified health centers and the U.S. Department of Veteran Affairs. Participants can also find out about the program through other channels, thanks to a robust network of dozens of community partner organizations, as well as strong social media, press, and other communication efforts. These interested individuals can join as quote-unquote direct volunteers by enrolling through the program's website, joinallofus.org, or through a smartphone app. In terms of the current protocol, currently anyone living in the United States ages 18 or older, able to consent on their own, not incarcerated, can choose to enroll in All of Us. We are working to make the program available in the future to others, including children. In the current protocol, participants first enroll and consent. This is a virtual consent that is interactive. It includes a combination of videos, information screen, as well as quizzes to assess someone's understanding of the consent process. So they consent to join the overall program. They consent to authorize sharing of their electronic health records with the program. And they also consent to whether they choose to receive their DNA results or their genomic results. It is a choice, of course. Any electronic health record data that is shared with the program is then cleaned, curated, and de-identified before being made available to researchers. Participants are invited to complete surveys at their convenience. Currently, there are 3 surveys available to individuals when they first enroll that focus on demographic information, overall health and lifestyle. Additional surveys ask about healthcare access, family history, and personal health history. Additional surveys are released over time based on our scientific framework as well as the needs of the researcher community. Participants may also have an invitation for physical measurements to be collected and to provide biosamples at a partner site near them. This includes about 4 tablespoons of blood for DNA, plasma, serum, cell-free DNA, and RNA. If the participant owns a Fitbit or has an Apple device, they can opt to share their data with the program on an ongoing basis. We are working to expand to include other wearable devices, and we're also exploring opportunities to use smartphone apps to expand the different kinds of data that people could share, such as mood and cardiorespiratory fitness. We are currently collecting electronic health records from participants located in our healthcare organizations. The initial data that we're collecting is shown on the left, includes demographics, visits, diagnoses, procedures, medications, and labs. We anticipate expanding this list with time to include further data types as well. We currently operate under a bring your own device system for wearable devices, starting with Fitbit and Apple Health. All of Us is exploring how we can expand wearable data collection to diverse communities, including those who may not have their own wearable device. This is under development, but it is a challenge that we are aware of and hoping and planning to address. Of course, to accomplish this major undertaking requires a research ecosystem of its own. So here you can see the major building blocks of the consortium. We've talked a little bit about the Healthcare Provider Organization Network, those enrollment institutions across the country that are helping participants to join the program. As that data comes in from many sources, including their electronic health records and so forth, that data is stored at the Data and Research Center. We have the Participant Technology Systems Center, which creates both the apps and the various platforms by which participants enter in their information, they share their information, and the research institutions can reach out to those participants for the longitudinal engagement and retention. We have a biobank that collects and has the capacity for 35 million vials, and so forth. We also have a network of trusted community and provider partners as well, again, important to our community-based participatory research principles and our design. So this here shows our consortium members, the many, many institutions that are helping as, again, those really important building blocks across the country. And then here you can see the community and provider partner network organizations, some of which you may even be affiliated with, who are joining us in this effort across the country. So for our genomics plans, we also have an infrastructure providing 3 genome centers that are generating the genotyping and whole genome sequencing for the 1 million or more participants. There is also a genetic counseling resource to support the responsible return of information to participants should they have either questions or medically relevant findings based on the analysis that's done once they do consent and choose to receive DNA results. Over time, the program does anticipate providing several kinds of information to participants. So from the genomic perspective, that includes both traits and ancestry, which are kind of more recreational genomics, as well as drug-gene interactions, and then genetic findings connected to the risk of certain diseases. So next, I'm going to shift gears and talk a little bit about our scientific framework. As a broad research program, the All of Us is building a data platform to support research on many aspects of health. No single medical or biological research question per se. The scientific framework will serve as a key guiding element as the program continues to grow over time. So you can see here the types of research and research studies that we seek to enable, including to increase wellness and resilience, promote healthy living, to reduce health disparities and improve health equity in populations that are historically underrepresented in biomedical research, and so forth. The way in which we do this and how the All of Us research program is designed to lead to discoveries is that participants share their data in many different ways, information that they provide directly, they authorize sharing from their healthcare institution, as well as from the specimens that are collected and analyzed over time. That data is then protected, cleaned, curated, and shared. Researchers study that data, participants get information back to them, and then researchers share those discoveries, both with the participants as well as the community at large. Of course, 2020 has been anything but a typical year. But looking back at our current progress, we opened doors about 2 years ago. And in a short time, we have engaged the largest, most diverse cohort assembled in the United States with over 271,000 participants who have completed the full protocol. We've built a substantial infrastructure with over 100 plus academic, VA, federally qualified health center partners, over 320 clinics, and a biobank with 24-hour shipping across the country. And again, that capacity for 35 million vials. In the midst of these efforts in 2020 came COVID-19. We have all, as a research community, come together to urgently address COVID-19 and to inform future pandemic preparedness. Every one of us has been touched by COVID-19, but this is also the time that clinical research means more than ever before. With its scale and diversity, all of us is well positioned to make special contributions to these efforts. So our program is addressing COVID-19 in 3 key ways in collaboration with both national and international partners. The first is through antibody testing. We support antibody testing on samples from 10,000 or more participants who recently enrolled to help researchers better understand the origins and spread of COVID-19 in the US by starting with samples from March 2020 and working backwards until positive tests are no longer found. These tests will show the prevalence of novel coronavirus exposure among all of us participants and help researchers assessing varying rates across regions and communities. We have a COVID-19 survey for all participants to better understand the impacts of COVID-19 and the pandemic, including on physical and mental health, employment and income, and substance use over time. And in terms of EHR data standards, more than 200,000 participants have shared their EHR with the program so far. We're gathering standardized information about COVID-19 from those records to help researchers learn more about the symptoms, associated health problems, as well as the effects of different medicines and treatments. And so collectively, these efforts will be an important step toward helping researchers learn more about COVID-19 and its impact on diverse communities across the United States. So for many, the importance of research has never been more clear. And so next, I want to talk about what we're doing with this data to share it responsibly and make it available, again, to accelerate and catalyze innovation in health research. So the Research Hub specifically at researchallofus.org is the online platform where researchers, as well as the public, can access different tiers of data in the All of Us research program. The goal is really to allow researchers to generate hypotheses and to begin assessing the potential of data for their studies. So although right now the cohort has 271,000 people who've completed the full protocol, again, this data will grow over time. In terms of a timeline of that data, the data browser is what's publicly available. That launched earlier this year, and it gives interested researchers as well as the broader community a first opportunity to see what is in our growing database. The beta release of the Researcher Workbench launched in May of 2020 this year, and it has the survey data, physical measurements, and electronic health record data information. We do anticipate rolling out additional data in 2021, including potentially wearables and linkage to external outside data sources such as the National Death Index. And finally, moving into 2021 and beyond, we anticipate we will have additional data types, including the genomics, assays, more surveys, and other digital health technologies. So again, at researchallofus.org is the research hub, essentially, that online platform where researchers can access the All of Us data. And so the next couple slides will give you a brief overview of the current status of the Research Hub, that public-facing side, as well as the Researcher Workbench. What I want to really just take a moment to point out is that thinking again in that non-traditional and innovative way, we are also bringing researchers to the data, as opposed to having that traditional approach where the data is downloaded to researchers on a local device. So the aim in bringing researchers to the data is to make sure that it is more secure, more efficient, and more cost-effective at scale. Again, given the large size and the voluminous amounts of data in this program. So in terms of reviewing what is currently available at a glance, you can see that the enrollment numbers, as they've increased over time, as we have added enrollment sites, you can see in terms of our commitment to diversity and participants from different backgrounds, the current distribution of race and ethnicity. So about 50% of the participants are from non-white backgrounds. We also have a good distribution of ages, ranging from 18 and above, and then all geography as well, in terms of all 50 states being included. Enrollment is done both in English and in Spanish, and there are interactive mobile exhibits that are traveling the country. They are currently paused in light of COVID-19. But this gives you a sense of the snapshot of the participants that have joined the program and the data that are currently available. If you go to researchallofus.org, you'll see the data browser. And in this, it is essentially an interactive tool where you can search summary statistics. It's open to everyone. And this gives you a sense of the kinds of conditions, labs, measurements, et cetera, that are in the database and currently available. So again, the next couple slides walk you through. If you are searching for specific keywords, such as diabetes, for example, and then to see what comes up, what's currently available in the data set. So this is giving you a quick tour of the data browser, highlighting the key elements. So once you enter in your specific condition or keyword, you then get a series of results, top 10 by descending participant counts, which gives you kind of insight into the participant cohort and research opportunities that might exist for future studies and analyses. If you move over these different areas, you can see deeper detail as well. You can also view the full surveys that were provided to the participants to understand the data sources, the questions that were asked, and how those items were collected. You can further explore the breakdown of the responses by sex assigned at birth, as well as age. And so that's what's available in the public level data browser. So shown here on the left side of the screen, there's the data browser, data snapshots, a survey explorer, as well as a help desk. And that launched last year. What more recently has become available in a so-called beta phase is a researcher workbench that is restricted in the sense that it is a passport model. You do need to request access to it. And that includes a data dictionary, a concept set selector, a cohort builder, notebooks, as well as an additional help desk. So this section does require a user to register in order to gain access, but it provides researchers with further access to the data and that initial set of tools. So having this next step of data be available and open in a beta phase is really important to accelerate new discoveries. We're building this platform together with the research community, and we are actively seeking researcher and funder input to make it more robust and to learn how the data, tools, and policies are working, both to protect research participants, to innovate health research that can be done. So the current data that are available in this researcher workbench include the physical measurements, survey data, some EHR data. Again, there is more to come as genomic analysis is now underway, and there are tools that are available as well. Just want to clarify for a moment the access and security. As part of the National Institutes of Health, the program is protected under a certificate of confidentiality, which was also strengthened under the 21st Century Cures Act, the protections that are provided to participants. We employ a data passport model for this access tier to grant researchers broad permission to explore the data for a wide range of studies. Currently, this beta testing access is available to researchers who have an ERA Commons account and for their institutions who have signed a data use agreement. In the future, the program will continue to open the platform more broadly. So this is unlike other programs that tend to determine data access on a project-by-project basis. Again, we employ this data passport model to grant approved researchers broad permission to explore that data. And so to facilitate collaboration and to keep this data secure, it is hosted in a cloud-based system. All the tools and data are in one place. Data downloads to a local machine are not allowed, and researchers receive free credits to cover the computing and storage costs of the analyses that they run. This is an example of what the Workspace looks like, where you store your data and analyses, you generate your cohort, your concept set and variables, and you can review your notebooks as well as share them with others, either within your institution or in the future other researchers that you may collaborate with. This just provides you a glimpse of what to expect. Again, we do have tools available to help you build your participant cohorts and data sets and to customize the concept sets with medical concepts that are most relevant to your research study. There is a research support team dedicated to making the experience and experiments possible. And so this just gives an overview of the different kinds of support that are available to researchers for, again, those tens of thousands of studies that we anticipate will be done in the years to come. So I just want to take a moment, of course, to address the limitations. Although the All of Us research program does reflect the broad diversity of the United States, it is not nationally representative. It is aiming to reflect the diversity of our country. So it will not be a statistically representative cohort because we are hoping to overrepresent communities that have actually been underrepresented in biomedical research. And the data, while voluminous, is not comprehensive. It continues to expand in depth and breadth as the program grows over time. And because, of course, it is a voluntary research program, not all participants will have all data types available in terms of what they choose to share, or for those individuals who are invited to come in for physical measures and biospecimens to be provided. The All of Us research program is assembling the most diverse, large-scale cohort of its kind, with plans for genomic data and comprehensive clinical information. We are successfully engaging participants as partners in both the design, the operations and implementation, and the value that is provided to participants in the future. New data types and collection continue to be rolled out. And again, ancillary and add-on studies of specific populations and disease states are possible. This is a community of research participants hungry to help advance biomedical research and innovation. In addition, we could facilitate research across multiple disease states that could serve as controls for disease-specific studies that lack healthy controls. And so as these slides are shared, there is a link here to an Anthem video that does describe as well the All of Us research program. And I just want to thank you today for joining me. So if you'd like to learn more about the All of Us research program, social media tags are here. Of course, the website allofus.nih.gov. And if you're interested in learning more from the researcher perspective, it's researchallofus.org is where you can find that data browser and the researcher workbench. And then joinallofus.org is the participant and volunteer facing side where they can learn more about the program, participate in the virtual online consent, and begin to complete and share information. So thank you so much for your time. Again, I want to thank SOCRA for this incredible opportunity, and I look forward to discussing and answering any questions.